Years of work gone in a flash of flames.
Don't salvage anything out of this.
Hundreds of thousands of bees dead.
There's so much work just going up in flames. If there's an average of 50 or 60,000 bees per hive, it's a lot of bees that just went up in flames here.
Today's the first time Stephen Beamish has been able to face cleaning up after the November fire that ripped through his hives near Kempsey in the mid-north coast of New South Wales.
It's just too depressing. I just didn't want to face it. I'm going to have to just clean up what's left. There's nothing that I can retain to use again hardly, except for the straps, the M-locks.
His bees were already struggling to make honey because of the drought.
I haven't extracted any honey this season, so that's my income's sort of zero. They need the flowers. They need the pollen and the nectar. That's what they survive, and that's what they feed their young baby bees. So if they're not getting those, they're not breeding up, and they'll just die out.
The bee industry estimates about 10,000 hives have been destroyed, and many more have been damaged across the country. Another fire near Grafton burned 500 of Stephen Fuller's hives.
It's very disheartening. The distressing calls from the animals straight up was very unnerving. Noises I have never ever heard in the bush, and I've been in the bush for over 40 years.
Stephen still has about 1,000 hives, but the charred bushland means there's no food for his remaining bees.
We've lost about 90 to 95% of our floral resources in the forests. It leaves us with our area that we cover, only approximately 5% left that we can go. And that's really hard because the floral resources are very, very limited.
Since then, he's had to constantly keep moving his hives to get them out of danger, which is stressful for both Stephen and his bees.
They're my babies. That's the worst part of it. I'm very passionate about my bees. When some of our bees are being moved 3 to 4 times in 1 week, we're losing bees, not to fire now, to actually moving them to save them.
Stephen estimates the fires have cost him more than $2 million. Add to that the impact of the drought, and his honey production is down by 90%.
The whole lot have got to go.
And the fire season still has a long way to go.
I don't know what it'll mean. It's going to be a long road then. It's going to be a long road. We've got to go maybe interstate, maybe further west. The costs are going to be astronomical.
Some North Coast beekeepers had planned to take their hives south, but fires in the snowy mountains and on the south coast ruled that out. Those fires burned even more hives, worsening the honey shortage, with state production already down by half.
Well, it's going to have a huge impact on honey production. I can't see any honey being produced here locally now.
In the short term, the industry says that means beekeepers will be paid more for their honey.
That's no good to me. I haven't got any honey to sell, and I won't have any until at least New Year, if I'm lucky.
With the shortage expected to last for months, major supermarket chains Coles and Woolworths have told 7:30 the shelf price of some Australian honey has already increased.
And that's just the start. The loss of bees could even affect the pollination of staple fruit and vegetables.
Almonds are an example of a highly dependent crop, and here at this farm, raspberries and blueberries depend on honeybees and stingless bees to transfer pollen to get good fruit set. Each flower needs several visits by a pollinator, so if we have fewer pollinators, then it could compromise the quality and quantity of fruit.
As a stopgap, The New South Wales Apiary Association wants access to new areas of national parks, which the government says it'll consider, along with any impacts on wildlife that need the same food source.
Longer term, we need to think about floral resources and planting more trees in the landscape, planting more shrubs, herbs, and that's something that I think, we need to have policies with government help.
For now, though, the focus is on just getting through the summer.
It's not a good outlook. Not a good outlook at all. We really need rain. That's the only thing that's going to save a lot of things.
This summer, much of Australia's southeast has been blanketed by smoke. Some of our major cities have experienced some of the worst air quality in the world.
Almost every morning with the smoke, I'll get up and have chest pain, sore throat, the feeling of not being able to breathe properly.
In Canberra, Hannah Thompson has complicated medical problems, including lupus and autoimmune disease. And she says the smoke has made it much worse.
On bad days with the smoke, I've been feeling really sick, nauseous even, gagging over the sink.
Both Hannah and her 11-year-old son Vinny also have asthma and have been struggling for weeks with smoke in Canberra.
I'm worried about my son, and I'm worried about the long-term effects of this. I mean, if this just keeps going on, and they're saying, this is like smoking a pack of cigarettes a day, my 11-year-old son is smoking a pack of cigarettes a day. What is that doing to his lungs?
For weeks, medical experts have warned of the hazards of prolonged smoke exposure.
Looks good. I do feel lucky that we're not caught up in the fires, but I don't think people are realising actually the long-term damage of some of this smoke as well.
Every epidemiological study that's happened has shown that there's no such thing as a safe level of pollution. So in Australia, we have the cleanest air in the world, probably. Our levels of pollution are very low, typically. And even at that lower level, there's still measurable health effects.
Yeah, I just can't breathe sometimes.
Even professional athletes are feeling the effects.
Slovenian Dalila Jakupovic retired from her qualifier after a coughing fit.
Experts are warning of the serious long-term impacts that could follow.
The people that I'm most concerned about are children, because children will have a long time to have lots of exposure year in, year out to develop those chronic consequences of bad air pollution.
Since the beginning of this fire season, there have been 28 deaths directly linked to the fires, including a young woman who died from an asthma attack. There's also been a spike of admissions to hospital of people with breathing difficulties, but the longer-term health impacts are the great unknown.
We'll be able to start measuring things, as quick as a few months after the smoke dissipates. But in terms of long-term health effects, probably we're going to have to wait, maybe 10 or 20 years to start to measure what's happened to people.
Paula Borwell is 8 months pregnant with her first child.
Long term, we don't know what those health implications may be, and I probably won't see that until my baby gets older.
Paula's husband Richard is particularly worried about what happens when his daughter is born.
She will be taking her own breaths and she's going to have small lungs, and it's not getting filtered through Paula's body, which I assume helps the baby out, so it is quite scary.
Professor Brian Oliver is an expert in respiratory illnesses and says expectant mothers are right to be concerned.
We know that if women smoke when they're pregnant, that the child's born small, and the child is often born with several organs that are perhaps underdeveloped, and that child is more likely to develop chronic disease as it grows up. So it's more likely to have diabetes, it's more likely to have neurological conditions, it's more likely to have respiratory and cardiovascular disease. And we know that women that live in really polluted areas, the same thing happens there.
200 firefighters and mine personnel are battling the worst blazes in a disused mine near the Hazelwood power plant.
In 2014, a coal fire near Victoria's Hazelwood power station blanketed the district with smoke for 45 days.
20 firefighters have already sought treatment for the effects of carbon monoxide.
Researcher Michael Abramson studied the effect of prolonged smoke exposure on unborn babies.
The babies who were in utero at the time of the fire have abnormal vascular and respiratory function. They're more likely to have respiratory symptoms such as coughs and colds, and they're more likely to need treatment by their GPs with antibiotics and bronchodilators and other medication. But at this stage, we don't really know the long-term significance of those findings.
G'day Pete, come and we'll have a quick look at the map and see where we're at.
Volunteer firefighters have spent months on the front line of a horror bushfire season.
Okay, yeah.
So I'm starting to lose count of the fires that we've actually had to deal with. So it's not been one fire front and sort of deal with it and deal with the run that it's done. It's a case of being on top of one, and before its smoke has died away, we've had another.
As well as the immediate risk posed by the flames, smoke inhalation is a constant threat for volunteers like Peter Bennett.
You'll notice that there'll be a lot of people with a bit of a croaky voice, whether it's dust or smoke. But sort of a couple of weeks and so that usually sort of clears up again. But it depends on the severity of and how close you've been working to it.
Another member of his crew is already feeling the effects of exposure to toxic smoke.
He went to the doctor, and it was a couple of the nurses sort of said that he should give up smoking, and sort of he's never been a smoker.
They're getting massive exposure, and they're also getting exposure to things, lots of the gases which would otherwise dissipate.
Today, the federal government announced $3 million for research into the impacts of prolonged smoke exposure. Scientists predict those impacts could become widespread.
If this year's bushfire season becomes the new norm and we are exposed to this every year, then the likely health effects are going to be really measurable. They're going to be much more prevalent. We're going to see much bigger impacts and probably see them sooner.
You can normally see the New South Wales snowfields from the tiny Victorian town of Cudgee-War. Today, the air is thick with ash and smoke, the landscape drained of colour.
As you can see, what we had's gone.
This is now all that's left of Alice and Greg Albert's 700-acre sheep and cattle farm on the outskirts of Cudgee-War.
This was the wood heap. Luckily there wasn't a lot of wood in it because we'd used most of it through the winter. Just the house, and then out the back had a snowy hut, sort of a veranda at the back, and garden most around. We lost the kids' cubby house.
The couple has lived here for 38 years, raising 3 children, a flock of superfine merino sheep and a prize-winning garden.
Yeah, the garden was my pride and joy.
We used to have it in the garden shows.
People
for
came out and
region.
Go look around the garden, so...
It was pretty important to us.
They're now living beside the smouldering wreckage of their home.
Our daughter brought a caravan from Denison in Gippsland up for us, and her husband and little 2-month-old baby. Our son lives here in Walwa. His house was also attacked first.
As the fire ripped through this tiny town, Greg was fighting alongside the local Victorian CFA crew, while Alice left her home to go help other evacuees.
Grabbed a couple of my mum's rugs that she'd knitted, and decided just moving the hoses around, hoping to at least save save the house.
And during the night we come here and it was all burning and tried to save it, couldn't. And then I stayed with it till we had to leave. And then I had 2 friends with me in vehicles and we withstood it for a long time, and then I said, we got to go. So I was driving the tanker and they said, you lead. I said, well, hang on to the taillight. And the guy went through the flames and smoke and we got out. So that was the main thing. And then I just kept fighting it and saving other people's houses and properties and so forth. And we saved a lot, we lost a bit.
They've spent the last few days shooting what's left of their badly burned livestock and picking through the rubble of the farm.
38 years of breeding superfine merino wool.
Shearing stand still standing, so that's motivation to stay. And
that's our part of the land and what we love and our community and everybody. So
yeah,
it's important. I won't go anywhere.
So which way did the fire come from?
From down the back way.
Down the road, Stuart Spratt and his partner took over management of the Corryong Caravan Park just 4 weeks ago.
There was a cleaning shed and pool pump shed just there. A reasonably large ensuite cabin there. And as we get further around, you'll see there's another 3 cabins down there that have gone.
What do you think this fire means for the local community more generally?
Yeah, look, there's people out there that have lost their homes, and we're hoping to get insurance and stuff like that. But we'll struggle. We're going to struggle to rebuild, but we will. But I've got a home to go to. Other people don't. The fires have gone, but there's still a lot left to do.
This fire's jumped the river on a number of occasions now, and it absolutely doesn't ask permission, it just comes across.
Nurse Sandy Grieve works in Walwa, just 5 kilometres away from the Murray River, which marks the border of New South Wales and Victoria.
We're aware that there is a difference between New South Wales and Victoria with regards access to funds to assist for people who've been evacuated. We know that in Victoria there is access to a payment specific to areas that have been impacted by the need to evacuate. New South Wales, that payment doesn't exist.
Cross-border issues are nothing new for this region. However, this fire season has pushed resources to the brink. The Victorian State Control Centre has confirmed to 7:30 that CFA and RFS radios aren't compatible. However, it says that all vehicles within 15 kilometres of this border should have access to both types. Despite that, one senior firefighter has told us that they've still had serious issues with communication while fighting this megablaze. Sandy is working day and night to provide healthcare for people across 3 local council areas and 2 states.
We respond to 000 calls that are, community members have accidents, they call 000 and we carry pages and Ambulance Victoria responds us to those accidents. We don't have the same arrangement with the New South Wales Ambulance Service, and so if somebody calls 000 just 5 kilometres from here, over on the New South Wales side, we aren't responded to those accidents, and so those individuals have to wait potentially 50, sometimes 60 minutes to get an emergency responder.
Sandy Grieve says she's seeing her community suffer on both sides of the river.
It's difficult to understand that Federation really ever happened, given the difficulties that we face getting services across the border and getting a consistency of service for people on either side of the river.